Cottle's line is an imaginary vertical line drawn from the spine of the frontal bone. This is the frontal bone. This is the frontal sinus. This is the spine of the frontal bone. From the tip of the spine of the frontal bone to the spine of the maxilla. This is the maxillary bone. This is the crest of the maxilla. This is the spine of the maxilla. An imaginary vertical line drawn from the spine of the frontal bone to the spine of maxilla divides the quadrilateral septal cartilage into an anterior and a posterior half. The anterior half is essential to maintain the integrity of the architecture of the external nose and cannot be resected. Therefore, deviations of the anterior half are dealt by the surgical procedure called septoplasty. The posterior half can safely be resected without altering the external architecture, and as a consequence, deviations of the posterior half can be dealt by the procedure called SMR or submucosal resection of the septal cartilage. However, we must realize that there is a growth center in the posterior half which continues to grow till the age of 18 years. As a consequence, the posterior segment cannot be resected less than 18 years of age. Hence, deviations less than 18 years of the posterior septum are dealt by the procedure again called septoplasty. However, deviations above the age of 18 years can be safely resected by SMR. If this segment is resected below the age of 18 years, then this center contributes to the growth of the entire mid third of the face. Hence, the patient will have developmental hypoplasia of the mid third of the face. I repeat again, if posterior septal deviations are resected less than 18 years of age, for example, if it is done at 13, 14, 15, if SMR is done at less than that age, then there will be developmental hypoplasia of the mid third of the face. So this is essential is the distinctions between the anterior, the posterior half and the Cottle's line.